Hey, hi folks.
Dr. John, how are
Okay.
you, man? Good to see you.
Hi everyone, this is my friend Zen, and this is a case study. And what you're about to witness is my good friend here getting it worked on. He has actually a little complaint about your back today, right? It was like sort of from riding a bike and you have tension going down your back. Now, just on the back story, I've adjusted Zen a number of times, and we've had other things that we've worked on in your body. Now, I don't know where the adjustment's going to go. I don't know what's going to happen. I know what you're complaining about, and now we're just going to get started, and we're going to dig in, and yeah, let's go.
Look forward to it.
Okay, cool. Let me just take a peek. So we're just going to check the body really quickly to see what his posture's like and what's happening with his system, because your body's going to adapt. It's going to change based on what's happening neurologically, so things will shift. And it could be about muscles that are on or off, or it could just be about, where you're holding tension, where there's not. Cool. Okay, let's get your face down on the table. Oh, good. Big breath in. All the way out. Sweet. Yeah, so we're just checking the leg lengths, because you're a little bit right short on this side at the moment. And, when I have my grip here, I can feel your whole body. I can watch your whole body. So it's a great start position for me here. Turn your head to the right side. Yeah, your body shifts a little bit. Go to the left side, as it should. Yeah, interesting. So to the left is causing some tension. Yeah, just relax your jaw now. No, keep there. Yeah, that's it. Sweet. Deep breath in. Out the mouth, go. Yeah, that's it. Let me see. All right, let's go face down again. And we're just feeling through the bones and the structure, holding a bit of tension here in the upper part of the back. I can feel when I push in here, like I can feel your throat resistance, okay? It comes up underneath your jaw, attaches up into the tongue, and it kind of goes up through the front of the face and down into the chest. So, you're holding there, and I could see when you were turning your head, when you go to the left, it a little bit more challenging. You went a bit slower, but when you went to the right, you engaged your glutes to try to get your head to turn. So I know that your body's misfiring at the moment. It's just a matter of figuring out what's firing and how. And so we're just going to look at your pelvis a little bit to see if there's some pelvic stuff. Let's do a few more checks as we go along the way, because I'm going to check some of your tissue. Turn on your back. We'll check your Iliopsoas just to see what's happening with that and feel the tension from the top down. So before I felt it from the bottom up, and let me have your arms this way, towards me. Yeah, just reach, good. And let your arms relax and stretch. And now I get to feel the tension from here. I can feel you locked here on the left side. Yeah. But I also, it's sort of like having a rope attached to something. You can feel where the terminal points are. And yeah, there's some tension moving through the diaphragm. And why don't you pop your watch off, and then we'll put that on the side, just because it doesn't get in the way. Yeah, sweet. There you are. All right. Just having a little sip of water. Hang on 1 second. All right, let's get into it now. So bend your left leg. I'm going to work on your psoas. And if I get you just to tuck your chin just a hair, lengthen the back of your neck. Now relax your lower jaw. Good. Now deep breath in. Exhale all the way out. So yeah, a little tension there. Well, let's just go again. Deep breath in. I think you'll allow me to get into that a little bit further. And exhale out. Good. So the psoas, the upper division, you're a bit tight. To pull it again. Deep breath in. I can feel it through your diaphragm on that right side, on this side. Exhale out. Yeah, we'll go a little deeper down here. And maybe a little digestive irritation. Breathe in deep. Big breath, big breath, big breath. That's it. Exhale out. Good. Yeah, definitely a little digestive irritation. Just a hair bit, but not much. Breathe in. There you go. And relax your jaw and out. Good. Inhale again. Relax your jaw. Exhale. Good. And inhale again. And then that's it. There's the freedom there, and the muscle tissue just gave away. I'm just going to check this upper division here really quickly. Let me see where we're at. And one of the things that I noticed before, you're holding across the diaphragm and through the sternum, which was attaching to the back there. And I know that you're complaining about that. I'm thinking maybe what we're going to do is, let me just quickly release your diaphragm so to free up your breathing. And because I believe that'll give us a good opportunity to open into the chest. So relax your jaw and then just breathe in deep and then exhale it out. Yeah, that's it. Cool. Other hand the same. Bring it straight this way. Yeah, actually. Bend them again. There. Do that again. There. Yeah, the shoulders are better for you there. Yeah. Okay. So I'm just getting into the fascial connection over here that connects up with the diaphragm and the rib cage. Relax your jaw. And we're also have a little bit of tension in this area. Sometimes comes from the stomach, because your stomach is right in this area. Good. And we're just going to go there. Yeah, just the jaw. That's it. Big breath again. Good. And then let it out right away. It's just moving a little quicker now. And again, in. That's it, out. Good, in. And then out. So the tissue is opening quite quickly, so I can shorten the breath, and it's giving me a better connection rather than deep go. Good, this wraps around. This hooks into your kidney on this side and hooks into your adrenal gland. And I'm going to just shoot it out there as a thought process that you have that contraction down the left side and it's adrenaline based. Yeah, it's cortisol based. Yeah, we can feel that happening through here. You can literally feel how it connects into this kidney and then it goes up the spine on this side. And that's how it was coming, right? It was coming from here and traveling up. Yeah, likely. I'm going to just release the other side of the diaphragm. Okay, this side's quite good now. Look, you can really see a considerable difference in the shape.
It was really painful up above here, and now I feel the difference.
Yeah. Good. Big breath in. That's it. Relax the jaw again. That's it. Yeah, okay. So on the right side, Zen doesn't drink, so like it's not, the liver tension here is not alcohol-based tension, which you find a lot of. And so it's not hard. And the liver is not reactive in that way at the moment, but I do feel tension through it. Yep. There you go. We're getting through it pretty quick. It needs a little bit of just time to hear. And the liver just, when you get up underneath here, you've got that integration of the organ that happens there. Yeah, see, you feel how that just released open and you were able to get that breath to happen through all the way? Yeah, that's exactly what we're talking about. So, see, that's it. Now you can see the whole rib cage lift. So the liver needs time sometimes to process that. Now I can look how far I can get under the fingers. That's pretty wild. I love that. Yeah. Look, and then all of a sudden the breathing mechanism is free. And look at the shape of your rib cage is now changed. Yeah. Yeah, so how's that? Yeah, right. Yeah, so and so that integration of the diaphragm, because the diaphragms, go across the top, there must have been something irritated, maybe a little anger. Go turn on your tummy.
Probably about right.
Well, everyone's got something every now and then, don't we? On your stomach, all the way down, Yeah, sweet. All right, excellent. Yeah, good, cool. Turn your head right. Let's just take another peek. Turn left. Yeah, good. Face down straight. Good. Yeah, great. Yeah, so this is more isolated now. Also, notice how soft that is as compared to before. You feel how that bounces into position now? Yeah, so a lot of that, because basically from here to here, that tension is kind of gone now. It doesn't mean there's not stuff to do, but you can see how that changed here for you, which is wild. Yeah, wild. And it also looks like, turn your head to the right, turn your head to the left. You took away the neck stuff that you were dealing with before. Go face down. Not that it's not there, but the order of which we have to go at it is different. So it looks like you have a little bit of like pelvic twisting, sacral tilting. Yeah. And okay, what we'll do is we're going to open up the rotators and we're going to decompress this left hip. We'll start with this one. Yeah, and just breathing. Yeah, so they're feeling the head of the femur just rolling around inside your pelvis, but you can feel the pressure through the muscles. Some of these muscles like haven't really been activated, so they're just sort of mushy and not happy. That's okay. But as we get through the tissue here, we're getting into the glute medius now. Great big, tiny muscle, giant stabilizer. Tiny muscle, giant stabilizer. Great for great because it's all the stabilization qualities it has in your pelvis. There we go. Just let that go. Good hip movement now. That's the way. So you can feel the left leg. It's got a lot longer. Drop some tension out. We'll just repeat on the right side. The right side is a little different. Relax your jaw. Lengthen the base of your skull. Yeah. So tuck your chin a little bit. Yeah. And see, we're just going to constantly come back to, lengthening, just like where this hairline is, where the skull sits on top of the atlas. And you're just going to kind of constantly open this space, but not hurting your jaw or like stressing it out. It's a different set of muscles. So just breathe that open there, just like that. There. Yeah, there you go. That's just, okay, so you're just working that. So you play with that. I'll play with this. Relaxing your jaw. Good. Yeah, there you go. You got it now. Good. That's it. Good. Because the end result is palpable here. Like we can feel that happen here. Transformation happens much faster when we had full buy-in from your top. Yeah, so right short still. Posterior inferior no. Anterior inferior yes. So tilt to the sacrum. Tilt to the sacrum. Decompress it. I feel like we need to. So the sacrum's holding a little bit. It's a little tucked under, and you've got some patterns of reactive patterns here in the actual ligament structure of the sacrum. So I'm just going to release both sides. Just a deep breath in, and then I want you to focus on, the front of your pelvis, like the front where your body touches the table. And then when you breathe into the relationship of how your hip feels into the table pads, okay? So yeah, that's it. There you go. That's it. Good. Good, that's the way. Good. All the way through the inner thigh on the left, inner thigh on the right, and there you go. And the quadricep at the front, so the front muscle. Good. Good. Right through to the kneecap here on the left side, right for the top of the knee. There you go. There it is. That's it. That's it. Bingo. And that's finished on that SI joint. So the SI joint here is now a bit juicier. We've got some good movement. It's not as reactive. Okay. And we'll just get this one now. Just straight through to the pubic bone, so front of the thighs, inner thighs, up through the groin. Good, down the leg. There it is, bingo, bang, that's it. As soon as your mind goes there, it creates the change. That's the way, down the leg, you can feel it go through the knee. Yeah, there it is, down into the shin, bingo, down into the ankle, big toe. Nice. Good, there's the full line, isn't it? Right at the seat. Yeah, there, back of the legs, this one. Yeah, both, even this one. There it is, that's it, nice. Good, that's cool. There you go. So the SI joint is a bit more open now. Is to change the alignment. Now it doesn't really change the alignment overall. There's a number of ways to approach this, and right now we're doing an integrative session, and I feel like what your body needs. Like I can make a couple of choices. I can get you to do a lot of the work. I can do some of the work, you can do some. I think what I'll do is I'll adjust it. So lay on your right side, face me. Yeah, so I'll put a little bit of an adjustment through your pelvis and make it and help it with a bit of a boost to move. And because I don't really see you that often, so I don't get to adjust you that much. And which is okay. Yeah, so I just know your body, and I think if I give this a little bit of an adjustment. So we're just going to lift the one side. It's mostly on the right, so I know I got it in your left, but I need you to relax the right side of your hip. There it is. That's it. Good. That's enough. You can go face down. There's a second level to it. There's another adjustment in there. The question is, do we push through that first one to try to get it? I think not. I think what we need to do is continue down the road. Little manipulations, Yeah, because now your pelvis is, and the sacrum has turned. So it looks like you've got a little rotation in this as well, but I'll bring it back around. Let's have this side up and I'll do that. I'm going to draw it around. This is a little bit too, there's an internal line of muscle that comes up the center of your groin that's got to twist it a little bit. Oh, that's a yoga posture to do you some right? Yeah, that's it. That's why it works.
Yeah.
There it is. I'm just going to wait for the tissue to respond. So actually, you know what? You feel the right groin, draw it into the left groin. Yeah, that's it. There you go. Good. Now release it. Relax your jaw. Good. And a little bit more tissue response. Just a little bit more. We'll just quickly, the hip is holding. Yeah. So the outer hip is holding, which is causing tension on the inner pelvis, inner groin. The muscles on the inside of the thighs that connect up into the pubic bone, pubic symphysis area. That's it. And then, so the tissue is just responding. It just takes time. Like right now I'm working the fascia that is around the, what you call the greater trochanter. Yeah, so it's tight, but yeah, it's tight. But I'm not rubbing, I'm just waiting for responses. I'm nearly there. There you go. Good. Good. It just took a bit of time to get to that level of fascia. Actually, I'm going to quickly check the alignment. Can you go face down? Before I adjust it, I have a feeling that maybe it could have changed position. It may need a little bit of a boost still, but let's see. Yeah, no, it changed. Awesome. So we'll move on. The adjustments. Oh, no. Turn your head to the right. Let's take a look. Face to the left. Yeah, no, it needs help. Okay, face me this way on your side. We'll adjust it. You have all these things. You don't know if it's actually happening until you actually know it's happening. You have to constantly go back into the system and check in sometimes. Relax your jaw. So we'll just adjust that. Posterior, inferior. Ilium on the right side. Just means it rocked backwards. Relax your hip and suck your belly in. Okay, that's enough. Just relax now. That's it. One more. That's enough. Okay, cool. Face down. Yeah, inner thigh line. So just meeting a little resistance, right? It wasn't clean, right? The adjustment wasn't clean. You didn't have a really clean release. Yeah, because right at the end of the adjustment, there's additional tension, there's additional baggage. So rather than forcing my way through, we're going to go on a fact-finding mission because I'm really curious as to where it's coming. I can see where it's coming from. Turn your head to the right. Turn your head to the left. Yeah, okay. You see, we're not quite there yet. Go back to the center. Okay, so we'll just open up your lower back and the sacrum. So we're just going to, there it is. There it is. That's it. There it goes. That's it. There you go. That's the one. There it is. Good. And so there's a flow happening right now. That's it. Good. Yeah. And your head got longer. How's that, huh?
Needs taller.
Yeah.
Not as tall as you, though.
Yeah. So the energy's back into the system. This is more clear. Boy, you were just really bogged down in that area, weren't you? I wonder if we can get the sacrum. Okay, just a bit. That's pretty good. I'm pretty happy with that. Let's take a look at the alignment again and see if you're still holding. Yeah, so that released it. Not 100%, but pretty close. Turn your head to the right, to the left. It just means there's more integrated movements here. So now your neck is playing up. So the feedback coming through the leg is definitely more prominent now from your neck. The lumbars are pretty free till we get up into the mid-thoracics, but we'll come back to all that stuff. So where's the neck? What are we going to do here? Yeah, so let's decompress the shoulders a little bit. All right, here we go. Let's go up. Let this right arm hang. There you go. Let it be free. That's it. So we'll decompress the shoulder, just working on the, yeah. So deep breath in, and where we feel me pushing, think of it like an ice cube, and then allow it to melt, and let it turn into water down the shoulder now, down the arm. There you go. Down the elbow. There it goes. Down into the forearm, out the fingers like a gas. There it is. There you go. Good. So every time I hit one, deep breath in, and then melt that ice cube, let it transform down the arm. So you're just discharging it out the arm, essentially. Yeah, good. So we'll get you to just change. I just need to treat a little bit more. So as I push into, this looks like the lower division of the infraspinatus. Yeah, there's the reaction. Yeah, that's a sensitive one there, isn't it? Yeah, upper divisions of it. Yeah. See, but that links into the jaw, it links into the lower neck. I can feel that you know, you can get that circle there. You can feel the connections. And this is front through to the clavicle. So in a minute, I'm going to support the clavicle, and then we'll clear the rest of the way. Because right now, what we're doing is we're just liberating the energy that's in this area. And what's happening is it's just accumulating here in the shoulder. It's not passing through the arm just yet. Well, we're going to get it to pass through the arm. We'll get it to discharge. It's just not, at the moment, it's just freeing energy up that's bound into the body, and then that, it is just lingering in the area. Keep breathing. That's why you stop breathing, because you're holding your breath, because it's just binding up in this area, and it doesn't have the pathway open yet. But as soon as we get that, you'll feel it. So it's still binding up at the front of the shoulder. I'm about ready to get you there. Not 100% really. Yeah, okay, now I'm going to come in and I'm going to support you up underneath in the front. There it is. And here it goes, 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 here it goes. Deep breath in, and then all the way through the bicep, down through the elbow. Go. There. Yeah, right there. Go again. There it goes. There it is. There it is. There it is. That's it. That's it. Down. Let it out the thumb, middle finger. There you go. Good. Nearly there now. The wrist. Let the wrist. There it is. Good. Pinky finger, ring finger on this side. Good. Relax the jaw from the ear. Good. Big breath. There it is. Down, 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 down. Bicep, elbow, bingo. Wrist. There it is. Nice. Just a little windy in the forearms. It's okay. And then there it goes out there, and whoo. There, the wrist. There, here. Good. Oh, that's why you're so bound up. I get it. Yeah, I see that one now. Too much time. Maybe the thumb, the computer. Could be the computer. What's too much mousing, maybe? Yeah, so this is quite good now. This, you feel the difference?
Oh,
Yeah, huh? So you've got that integration here, but this, not so much. And you're also, and here I can feel the front. I can feel the front through the center of the chest, and it still has you bound up across the neck. So we'll decompress the other side. I think it's quite good for you to get this done. So let's spend the time doing it, huh? Well, this side I can get in quite quickly. Yep. Each side's going to be a bit different. You can never really expect the right to be like the left and the left to be like the right. Otherwise, you'd have two right sides. Every person who's a lefty, they'll tell you you'd have two left sides if you want to be the perfect person. Here we go. Okay, here it goes. That's a much different pattern on this side. Good. I'm just going to sneak into the chest. There it is. Okay. There it goes. And then the shoulder. Yeah, happy days. Big breath. Good, just binding it up. Then let it go through the elbow. Drop the elbow now. Let it. There it is. Bingo. Gone. Ooh, yep. Let it flow. Let it flow. Let it flow. There. There. Just thinking of that Disney song. Let it go. Let it go. Yeah. Big breath. There. And then down. Through. Through. There. That's it. Just binding it up there. That's it. Just let it build it up and through the breath. It's just sticking in the shoulder. And nearly there for the movement down the arm. And there it goes. Bicep. A lot of that. A lot of front shoulder tension through the arm. Let it go. Yeah. There. A pretty popular pattern, this twisty stuff through the arm. There it goes, got it. you know, the bones here cross on each other kind of. So it's quite, there we go, common to get that, you know, almost like a DNA spiral where it spirals through the forearm. There you go. Okay. Good. There you go. You got this back. You got this back. You got this back. Begin. There it goes. Through the throat. Lengthen the base of the skull again. There it goes. Now you see that wiggle room that you had there?
Yeah.
Right? The only reason why the wiggle came because the tension was released through the head. And then you were just trying to seek center. You get it? Do it again. Yeah, and then lengthen, 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 lengthen. There, and see how you freed that. Now hold that in that space and just be patient and breathe within that space. So the space, which I mean just along like it's being opened, and just stay there focused with that, just that single thought, okay? For now, relaxing the jaw. Good. Yeah, so there's definitely stuff to do in here. But we knew that kind of going into this with your upper cervicals a little bit, only because I've worked on you before. But you never know what the system's gonna draw out. And the upper neck tension's passing through the skull across the occiput and the temporal lobe here. A lot in the temporal lobe and the occiput and the other temporal bone on the right. Yeah, the muscles of there you go, that's it. So we're just, actually you're alleviating a bit of cranial bone tension. Yeah. You know, as you breathe in, your head expands. Did you know that? Yeah, and as you breathe out, your head shrinks because the cranial bones move. The issue is when you get older, you're not breathing deep enough. You're not challenging the cranium to open and close. So you know what it does? It seizes up. And then you really got a hard head. You're stiff in the brain and stiff in your head. Yeah. Maybe that's symbolic. You become stiff and stubborn because your head is stiff and stubborn. I don't know, maybe. We'll see. There you go. Just through finishing the rest of the temporal bone. There you go, liberating that. And then we'll do the other side, it looks like. And let the jaw go. There you go. Good. Good. Yeah, so there's the suture of the occiput bone. So, you know, it's more than just, you know, massaging the tissue. We're literally just feeling the movement of the occiput as it rotates, as it flexes. And you can see that this one's a little jammed. Usually easier to do when you're face up, but so I might finish it while you're face up. Let's do that. Let's get you to flip over. How much you're holding.
Yeah.
Yeah. We'll just move this for a second. Right. Cool. Yeah, and then, yeah, because it comes straight through, wraps in, and there you go. Bingo, bango. We're right in, straight in. Just stretch the jaw. Yeah. Yeah, that's it. And then relax it. Yeah. Yeah, yeah, that, and then stretch it. There, that's it. Open more, like silly open, like ridiculous open. Big breath, chest breath. Yeah, that's it. Good.
So it's hard, isn't it?
Well, like I said, you don't notice what you don't notice, right?
That's right.
You know, it's natural. I find extraordinarily integrating into most people's emotional space is the face and the head. Well, think about it. Every emotion has a facial, you know, feature that goes along with it, right? A representation. Every thought. You know, your body has that same thing happening called body language. Some people can read it and some people are clueless about it, right?
Yeah,
But
so true.
and there are subtleties about body language that happen. What we see the external, but you know, it's really fascinating when you look in and you can see the internal reactions. Which, you know, you can see how I can feel the internal reaction, how this lower neck comes down and through the belly and
yeah,
down
the
through the leg.
resistance,
Yeah. Yeah, you can feel it because there's an element of that that's palpable to you. Yeah. There we go. And the jaw, that's pretty good actually. Yeah, you did really well with that. Notice how the sternum's quite open, huh?
Yeah.
It's not always like that, brother. No, so not everybody has that there. Okay, here we go. So the knees go down. Yeah, turn the palm. Yeah, that's it. Yeah, we'll start with that right there. And let the chin drop just a hair. Let the lower lip come away from the upper lip. Yeah, that's it. There we go. Now we're in. And in the mouth. There we go. That's it. There it is. So it's moving pretty rapidly through the tissue. That's great. Just feel it in the lower jaw and the throat. There you go. Then the arm, let the right arm. There it is. And then the fingers, out the fingers. That's it. There you go. And then lengthen a little bit more through the pinky and ring finger on the right. Good. Now turn the palm and lengthen the arm just a hit. No, other way. Yep. Now lengthen it towards your ankle. Reach. There you go. Good. Okay. Yeah. Now, and so the tissue is just releasing through the body. And it's in flux at the moment. So if you are watching in on this later, you're going to note what's happening at the left side of your body. And this neurological reaction that you're having on the left side of your body is the nervous system discharging through. It's a delicate balance between the release and the resistance to the release that is occurring on the left side of the body. Because I've got the buy-in on the right side at the moment. There's stability, there's openness, there's connection. At the left side, what's happened is the connection is in a delicate dance between disconnection and connection. And that struggle causes the left to vibrate up and down. Let the jaw spread open, please. Yeah, that's it. Close it. Good. Good. The willingness to open the jaw enough to get into it is pretty cool. There you go. That's it. Good. And that, in case you were wondering why you got so stuck, because it was going straight down. That one's a heart piercer, man. That goes right into the chest. Yeah, the jaw again. That's it. Enough. Good. Good. And then give me a big chest breath to open this gap. Yeah, and then exhale. So we're going to really challenge the gap, not pushing harder, just finding the way in. So a mouth breath in into the heart. Go. Mouth breath, mouth breath, mouth breath. Yeah, yeah. So exhale out the mouth. Now big inhale. Yeah, that's it. There you go. Through the chest, 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 chest. There it is. Exhale it out. Good. Yeah, and now we're, here it is, here it is, here it is. Gotcha. There it is. Okay, so we're able to get the shift to happen to the other side now. That's it. Good. A big breath. There it is. Good. And then release it. Good. And there's the spine, mobile. Wow. Little connection. Good. Now the head's got to come up because of the curvature changes that you're experiencing in your neck. There it is. Okay. And we'll just, there we go. Gotcha. We'll just wait for the tissue, then come around full circle. Good. Now see if you can lengthen the base of the skull. Now the other way. Yes. Okay, well, we're about to, so now what's happening is as I work through the fascia and the interconnections of what's happening through your spine, we're starting to, the dance between connected and unconnected is coming down into a closer focal point. In other words, before it was very broad, sometimes connected, sometimes disconnected. It's struggling to make the connection. But now we're honing in on the connection itself. We're sort of like, just finding the secret plug-in point. And then as soon as we do, you'll see that reflect through the head, the arm. That's it. Good. Gotcha. Good. And that little struggle there. Good. And then tuck the chin a little bit. That's enough. Good. Good. We're just settling through. Relax the jaw again. Yeah, it's enough. Good. Good. And then there's the connection starting to happen. Here it goes. That's it. So then I'll coach you into actually completing the circuit, because, the illusion is that, yeah, I'm here doing it to you, but I actually have to get you to buy in to create the connection. Okay, so here's how we're going to do it. I need you to open the palm on the left side wide. Good, that's it. And just spread the fingers open. And I need you to lengthen the wrist away from your forearm. Good, and then your forearm away from your bicep. Good. Now your bicep away from the shoulder. Good, now I need you to breathe right into your chest through the mouth. That's it. And exhale it out. Good. That's it. That's it. And then right through here. That's it. And connect this to the jaw. That's it. There you go. Good. And then there it goes. Bingo. You're in. 100%. Connected now. Good. And then through the arm, the thumb, the ring finger, the middle finger. That's it. There you go. That's it. There it is. There it is. Then as the tissue decides to change, because it is a decision of the tissue choice, you know, sometimes, there we go. Good. That's it. Good. Now notice that the desire of the left arm to be able to lay now as opposed to being up before, right? Do you notice the difference? Yeah, tuck the chin, lengthen. Good. And you still have some misalignments in your cervicals, so we're going to work and get this low one out because it's kind of just hanging, isn't it? That's it. Good. Yeah. And then the upper one, looks like is more available now. There. So through the sphenoid bone, it's the center bone of the skull. And then stretch the jaw away from that. And then lengthen the back of the head. Other way, other way. Yes, that's it. And now stretch the jaw again. And then release it. There it goes. Oh, wow. Man, that's like, and that what's happening there? That's all happening in this like inside universe, isn't it?
Yeah.
Inside the head.
Oh my God.
Yeah, because there's coverings on all layers, right? So we're working not just on the out. Looks like I'm working on the outer layer, but we're not. No. That the movements that we're making are inside layer movements. We're trying to work on the inside layer to create the expansion, the room, okay, to reach the disconnected points. Yeah. Because, you know, this left side for you is constantly coming back to disconnection still. So we need to we're just aware of that happening there. And then that's the atlas right at the top. Let the jaw open. Good. There it is. Okay, sweet. Yeah. And we'll let that just process for a moment. Big breath in. Yeah, and then exhale it out. Was this an injury? Is this an injury? You've injured this arm in the past, weightlifting or something?
Possibly, yeah.
Just curious. Because there's more legitimately hanging through in the tissue in this arm and the shoulder. I don't know if it's a thing for today. Maybe.
Definitely feels better, but it just, the tightness.
Yeah, there's something else happening also. It's not just about being integrated and connected. You have that, and then you also have this. You know, it's very layered, very, what is the word I'm looking for? It's not very often that it's just the one thing.
Right.
Yeah. It is quite often that it's the many things. So I'm just working through the tissue of the elbow. I'm feeling like people will want to see that. So let's see if we can get that into perspective. Good. Sorry for the lack of the professional photographer in tow. Now you know what those reality TV guys go through when they do these reality TV shows and they drop them off in the middle of nowhere with a camera and say, okay, film yourself doing everything. It's not so easy.
Not so easy.
Yeah. So we're just working through the tissue through here. Yeah, that's it. There you go. I'll just go lighter to accept a little bit more. That's okay. There it is. Good. Yeah, you must have injured this ages ago. Yeah. Because the bone position literally changed on this. Whatever the injury was, it probably had you fairly worried. Just don't remember it. There it is. That's it. So we'll just take it through to level 2, and then we won't go any deeper because, you know, the fascia, we've got essentially 4 layers of fascia to work through. But if we can get layer 2 to go, that is like, and we are already, this is all layer 2 fascia, what I'm working on now. then as we move through this layer, that will instigate change straight away. Sometimes layer 1 will. You know, more is not always better.
Yeah.
We see that all the time, don't we?
Oh, yeah.
Yes. It's, oh, we got to get, if there's 4 layers, we got to get to layer 4. Yeah. Well, no, not always. Not always. Sometimes if you bypass layer 1 and layer 2, you miss all the magic.
Oh, absolutely.
So you never know where the magic is going to be holding. It's either an elbow injury or possibly a wrist injury.
I think it's more the wrist. I think it's stemming from. Yeah.
Could be a combination of both. Maybe the whole contraption was injured. Something like this typically would have been like a fall on the wrist and elbow and the shoulder all together, contused or there we go, got it. There you go, there's your wrist. That wrist hasn't released in how many years, man? Wow, it took a little while.
Took a while.
Yeah, let that bounce now.
Yeah.
Interesting?
Yeah.
Yeah, that's a new, oh, look, that's a new flavor for the arm. Just let that go.
Oh, man.
Yeah.
What a difference. Oh,
Yeah.
it's all jammed up.
Well, it was, yeah. And you see, what's so relative about that? Well, I mean, just like your shirt, if I'm here, if I pull hard enough, man, you can feel that all the way on the other side.
Yeah.
Like if I pulled the shirt hard enough, the whole shirt would shift over, right?
That's right.
Yeah, so that's the connection. You're on a big, giant, layered skin suit, you know, all layers and layers upon layers upon layers. Cool. Let's get this back in perspective here so we get an overall glimpse of what's going on. There we go. Well, I think let's get you on your stomach and maybe integrate this now, this change. Because, you know, there's a variety of levels of change that I think a person can go through, different experiences, right? One of the things that I've learned that we can go so far, and there's lots of doors always to open, and there's a couple of things to decide whether we open those doors. The first one is are you ready? Physically ready? Do you have the stamina? Do you have the energy? Is there enough energy in the system? From me to you right now, you have a lot more energy in your system. You could probably go a little longer. The second question is if there is energy in the system, if I open these doors, if I go to the next stage, how long will I be in that stage with you before we're finished? Well, so then I guess the answer would be, it could be unknown. You don't know. You can assume it's going to be a quick entry, but you could be there for a long time. Yeah, so I'm just guessing at the moment that would open up a much longer session still. So what we'll do is I'm going to integrate your thoracics, get this sort of everything, this and this gelled together through here. And then I'm going to have you integrate it, okay? Because I know there's some powerful integrations that we need to do here and here that will help you a lot. Okay, first we'll just adjust the thoracics. See how you go with the adjustment like this, just relaxing. Yeah, you're okay. Seems like you're okay with it. Yeah, let that go through. Okay, I'll turn you over. Your spine's resisting a little bit. Flip over onto your back. We'll do it this way.
Yeah.
Yeah, crisscross for me. Good. Just hug in, deep breath. Good. Okay, hold. Good. Inhale again. Good. And ready? Exhale. There it goes. See, much easier. It's just all positional, isn't it? There it is. How's that?
Oh, yeah.
Yeah, that's like,
Oh, man.
hey, that's like, boom. Love it. Face down. Only because the position is all positioning.
Yeah.
That face down one can be awesomely confronting. And based on the bone position can, cause more tension than relieve it. And vice versa, the other way could be that too. I'm just going to take it through the feet. Hello, good morning, there you go. That's great. Okay, we'll integrate you now because there's still this happening here. And still this happening here. The tailbone tends to tuck, so you get into that mood, into the adrenals. Almost guaranteed the tailbone's going to tuck like a dog, right? Like an animal. Because we are, right? So what we'll do is we'll take the coccyx bone, and I'll have you just gently roll it open. Good. Changing that, you're changing the position on purpose, okay? So breathe into the lower coccyx bone here, right here. Yes. Good. And then, but keep the tilt happening so that you feel this curve starting to increase and this bone here dropping down. So we want to build this structure for now, for a second while you do it. One more breath in there. And then keep holding the structure in here, 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 right here, here. It's got to get plugged in, plug it in. Yeah, it just needs to plug in. So yeah, you have different levels of energy in the body, right? And then sometimes you're plugged into those levels and sometimes not. Good, that's all good. Then we'll have you lengthen the base of your skull to open that up. So the other reaction that you'll get is the tucking of the head backwards. So we're going to elongate there. You see that? You see how much room you had? And then like I was going to pull under the bone, I want you to feel like it's just going to lift the lid on the back of your head. This lid's just going to pop open. And relax the jaw while you're doing that and breathe this bone away from this bone while you keep the tailbone. Lots to do. There. So his body's come on board, right? Your body's on board. Now all of a sudden the paraspinal's turned on. You see that? Yeah. Just keep breathing here like this. Now of course you're creating this, but what's happening is you're bridging your mind. You're creating, not creating, but you're remembering the pathways to your greatness through your physiology. Yeah. Good. So we're going to amplify this a little bit. Good. Just keep going this way. There you go. Because you'll get lost along the way. It's normal. Yeah. We need more energy in the system, right? We need more energy in the system to move through to the next stage, right, of integration. So, but take your hands into this position and the other one the same. Then squeeze your elbows together. Bingo. Okay, great. So that adds energy into the system, more conviction, more commitment. Good. Yeah, you see how the head wants to come up? So bring the head up now. Bring the head up to here. Good. Just like that. Good. Yeah, just like that. Then just stay here long. Relax the jaw. And that's it. Yeah. And then there. And then use the breath in the lower back and draw it up into the rib cage a little bit. There, squeeze in, there. So now you're locked on. Now remember this, like even at a bare bones, science-based physiology, okay, of the system, these muscles love you. You need to love them. They have to be on all the time. They're your postural muscles. So what you're doing is that through your neuroplasticity is you're remembering the pathways of control. How do I control these when I'm not thinking about them, right? And then you're energizing that pathway, like plugging the battery back in. You're plugging the battery back in. You're plugging the and then when the battery plugs in, all of a sudden energy in the system increases. Good. Yeah. There. Yeah. There. Yeah. There. Yeah. There. Yeah. There. Yeah. There. Yeah. And then the head can come up. Then the head comes up more and more. Let it come up, peel the eyes, come up, look 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 up. And then just follow this, follow this. Let the inhale pull through the chest. Keep inhaling and just follow that natural pathway. Yeah, just like that. And it'll keep taking you. Yeah, that's it. It'll keep taking you. Keep breathing through the chest. That's it, just like that, just like that. Yeah. It'll keep taking you through the movement. Good. A little bit more through the throat and your eyes go further back and now you can lift up. Good. That's it. That's it. Yeah, that's it. That's it. That's it. And then just follow that breath. You feel the expansion in the chest wanting to happen. So do what you need to do to make that happen. Lift the chest up as much as you need to breathe through the chest. And you can use your hands as well. You can you can modify. Yeah, that's it. That's it. Yep. And you can even pull even more, push even more if you want to. Just keep feeling the natural growth. And notice that each time you come up, it's a little bit taller and you're going to get to a saturation point, right, where you can just lift into it, right? And then when that happens, then truly lift into it and breathe as much as you can into it. As soon as you start to feel it, it's coming because the energy in the system's building, right? Yeah, and then you can use your hands and you can create that, bringing that through to a full culmination. Good. Yeah, you're nearly there. Good. When you feel it, you're about ready to go over the hill. Just like you're going over the hill, and then the rest is going to be, it's like that last push. You go over the hill and you're going to reach the peak of it. Good, good. You're nearly there. And then add energy to the system by going into the posture that you feel that you need to go into to increase it. The body position, we'll call it a posture. Could be a yoga posture. Yeah. That's it. There you go, there you go, there you go. You're really close. Keep going, go, go. Now just lift into it. Yeah, just there. Keep going, keep going, keep going. Keep breathing, keep breathing. In. That's it. Now you're over the hill. Stay with it and keep coasting until you get further and further and deeper into it. Keep pushing, keep pushing, keep pushing through the chest, through the chest, through the chest, through the chest. Keep pushing through the chest, breathing through. Let the jaw open now. Now mouth breath only on the in. Watch what happens. Go. Mouth breath. Go. Yeah, I'm not doing it. That's you, man. That's you. That's you. I'm just connecting you to your neuroplasticity and the physical action and the attributes of change. Keep going, keep going, keep going, keep going, keep going. Then the head will start to want to come back, and then breathe with your throat open and stay in it. That's it. Good. There. And now full push. Go. Good. Stay right there and just breathe. Drop the head, drop the head, drop the head, drop the head, drop the head through the shoulders. And that's it. Keep going. Go, 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 go. And you'll reach another saturation point in 3. Roll the shoulders back. 2. Good. In 2. That's it. And then last one. And then, okay, bring it back down to the table. So we're working through the front pattern of the body, it seems like, okay? That's just the body working through its own little shindig. We'll take the arms and lengthen it from here and bring them up by your ears, if you don't mind. This way. No, 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 like this, long. Yeah. And the other one the same. Yeah, link up your thumbs, and then stretch your fingers and just kind of work the body. And then I want you to start, open the tail and then just start lengthening the system. And yeah, so it's amazing how fast you're into it, already, and then now you're in a fairly relaxed, but feel the paraspinals. Yeah, you feel how they're on now, like how easy it was to get there. Like you have complete conscious control now, right? That's it. It's good. And the tailbone is lifted, right? So the tailbone's up now. Just relax everything and let it go calm down. Let everything calm down. Good. And see, even when you lift, the tailbone is not generating energy coming underneath. It's not rolling energetically under. And you might have a body position of where it's not sticking out like that. That's okay. But the energy of it is not rolling under. It's all open through the lower back. And even that, when you shake your head, everything is sort of integrated now, which is great. Cool. Got so much more to do, man. I look forward to one day of working on these feet and changing these hooves. Okay. Turn them into something a little bit more soft, a little bit more supple. One day we'll be able to do a foot session and get the feet to expand. Yeah, they're so important. Your feet are just so important. I think people forget about them. They're too far from the brain.
Yeah.
Okay, brother, come on up.
Oh, wow. Man, that was awesome.
Just the ability to travel into the body and to breathe through the body. And then, because then you do yoga, right? And I do yoga, right? We do, it's just part of a tool that we use in our life, yeah? But then you see how putting yourself in the posture comes as a result of the desire to lift into the pose. You don't go into the pose because you're thinking to myself, I should do that posture, it's going to make me feel good. You do that because by feeling good, you actually get to the pose. The pose is a side effect of you chasing what it feels like to feel good. And so as you were getting into that expansion, it's like you had to keep going and expanding to get to the tissue that was not just here at the front, but up underneath inside the front to get to open and expand. And that all came from your pelvis.
And that was incredible because that release, I can feel the difference in my left side and right side.
Yeah, for sure.
It's just...
Yeah, it should be completely like...
Oh, mate, it just... You realize how imbalanced that was and resistant and locked.
Yeah, that's right.
Oh, man.
Yeah. We have to turn this for one more second while we get a couple of realizations, yeah? So
that was incredible, John.
How good was that release with the fascia when we opened up when I pulled the fascia open in your lower spine?
Mate, that was honestly, the pain was incredible.
Yeah, a little painful.
A little painful, but the release, my God.
Yeah.
I felt the difference.
Yeah, it just flushed through the whole body.
Flushed through, yeah. From top to bottom. It was like, wow.
It was amazing.
The floodgates open, mate.
Yeah. It was funny because I wasn't going into it expecting to have that release. I was just going into it going, okay, well, how am I going to get to where you're holding at the point? Like, short of like getting my hands inside of your body, right? Which essentially you physically are not capable, but energetically you might be capable, depending
Yeah.
on how you look at it,
That's
right? But that fascia was like, okay, yeah, the next natural step is what I need to do is this. This is what the body needs, and then not expecting any result other than the fact that okay, it's just the next step.
Yeah, next step.
Okay, well, what will come after this? We don't know.
Yeah.
But then all of a sudden you have that boom. I'm like, oh, hey, well, we were holding a lot there. Wow.
Oh, absolutely. And it's like a building block.
Yeah. Layers and blocks.
Layers and blocks, and just
Yeah.
I can feel the difference even right from my spine to my neck to my hips and elbows.
Yes.
I mean, even my wrist now.
Yeah. How's that wrist? It took a little bit.
Yeah.
We were talking a little, like we were conversing a little, just because I needed you to not think so much about it while we
Right,
were
yeah.
doing it, what we were doing to it, because I was still working it.
Yes.
Yeah. And you sort of had to be distracted, but not disconnected,
Yeah. Yeah.
right?
Yeah.
Because you were feeling it.
Oh,
But that was just a way for me to kind of like manipulate the conversation with integrity of where we're, and the conversation was the physical conversation, right?
Yeah, correct.
Not the verbal conversation. That
Yeah.
was just talk.
yeah.
Yeah.
Just talk.
Yeah. But then, of course, too, I think I was talking to you about what was happening. So even though you don't understand maybe the language that I'm using, right? It's still, I'm going to go on the subconscious is hyper intelligent.
Yeah. Yeah.
And so then your subconscious speaks to my subconscious, which then works it all out.
Yeah.
Is that cool?
Yeah,
I think
that
that's cool.
is-
Okay,
that is
folks. Well,
phenomenal.
this was a case study, okay, with the Zen. I don't know if we could. Yeah, so that was a case study with Zen, and
Dr.
thanks,
John.
brother.
Thank
Thanks
you,
so
Dr.
much.
John. That was
Yeah,
awesome,
great.
man. Really awesome.